Hello everyone, I'm Vish. I'm one of the junior doctor here at University Hospital of Leicester NHS Trust, Leicester General Hospital. And the topic of today's seminar is outbreak of SARS-CoV-19 in our surgical wards at the Leicester General Hospital, which is also a tertiary center as well. So going towards the background of our study, as we all know, SARS-CoV-19 has had a huge impact all over the world, including the NHS, where it has affected a large number of population. And since there are several SIRS. So since the second SIRS of SARS-CoV-19 on 18th of September, there has been a recorded death of well over 2,000 deaths in the UK. So, well, this study was done in the month of the October. So since then, there has been further number of deaths in the country as well. So when the outbreak began, several measures were introduced and pathways were created in order to execute the safe surgical practice and protect both patients and staff from the SARS-CoV-19 as well. So in line with that, there are several guidelines in terms of the laparoscopic appendectomy management, and then regarding even the cholecystitis management were introduced in our trust as well. So despite these measures, there have been a reported case of outbreaks in various parts of the UK amongst patients and the clinical staff, and our center was also hugely impacted by that one. So we report the experience from the University Hospital of Leicester NHS Trust, Leicester General Hospital surgical wards, where there have been 3 outbreaks in the past 6 weeks. So the study was done in between the time period of 10 September 2020 to 21 October 2020 as well. And we compiled the timing, initial source, number of affected individuals, and immediate management steps taken as well. So which will be further described in the figure 1 later as well. So there were no instances of patient mortality or harm, luckily, and all affected individuals were asymptomatic and remained so during the period of isolation, which we think was one of the major reasons that we are not able to pinpoint in the earlier days. So the results of our study, what we noticed was, following the first outbreak onwards, several measures were taken, among which 28 days surveillance helped us to understand several factors responsible for the recent outbreak. So what was the major cause of it and how we could eliminate it as well. And what we found from that 28-day surveillance, major highlight of those were several staff members were found walking out of the hospital in group once they had removed their PPEs. So this also caused the transmission. If someone was asymptomatic plus was the carrier, then it would certainly go to the next colleague as well. And the other thing that we also noticed was the communal eating and doctor's mess and everything. So this also caused one of the problems. So communal lunching with inadequate social distancing, attending work with symptoms, and sharing cars to and from the work, or not wearing PP correctly, were highlighted in the subsequent investigation. So this 28-day surveillance had a milestone effect in the healthcare, especially regarding stopping the transmission as well, because we are able to know different aspects of it. And the reduction in the number of affected individuals during the last 2 incidents reflected a degree of efficacy of the implemented preventive measures as well, which are reviewed again following the subsequent incidents. So especially in the present climate, a robust and the prompt response to the outbreaks is required. Continual iteration with regards to the need of PPE, adequate social distancing, and avoiding overcrowding in communal areas is paramount to reduce the probability of water outbreaks and interprofessional transmission as well. So even in line with that one, in our doctor's message, so we have also introduced different measures so that there's a certain number of people can get into the aid, and we've completely stopped the communal eating or free pizzas, which is one of the sad part of the COVID, I would say, as well. And asymptomatic staff testing, particularly in high-risk areas, could also be considered, but would require adequate laboratory capacities and rapid turnaround of the test results, which is usually done. So whenever there's any outbreak in the ward, what we do is we contact trace the health professionals or the junior doctors like us who are working in the ward during the morning rounds or other stuff, and then we do the testing of all the staff involved in it. So this is the summarization of the outbreaks at Leicester General Hospital. So Ward 26, Ward 22, and Ward 27 are the three surgical wards. Ward 27 is the post-operative ward. Ward 26 is the urology plus general surgical wards, and Ward 22 is the HPB wards as well. So usually the timing is in between 2 weeks period. If you look at the second and the third outbreak, I would say it's just 7 days apart as well. And the location of these wards are usually alley-like wards with 14 or 15 bays in it, separated just by a curtain with a distancing of 2 meters from each other's. And the affected individuals, so there were around 11 in 27, 7 patient and 4 healthcares as well. And Ward 26, just one health care professionals. And Ward 22, you could see 3. And Ward 27, this one was the first outbreak, and following it, the sad part is the infection prevention team were not able to trace back the source for it, and probable after the 28 days surveillance and everything, they thought like it was the healthcare professionals who who were responsible or were one of the reasons for the transmission of the virus as well. And following which, certain immediate management were taken, and then this patient were moved into a single room with in-suite facilities. Daily testing of the positive and remaining patient on the ward were done, and ward were closed for any further admission till the patients became negative on follow-up testing as well. And other remaining patients were shifted to another wards or COVID dedicated wards, we call it, to start their services as well. Several audits like hand hygiene audits, PPE audits, and IP training compliances, cleaning audits were conducted, and results were reviewed as well. And following that one, even though we took those steps, again, second outbreak happened in Ward 26, which is the urology ward as well. So what happened was one of the middle grade doctors, he had the symptoms of COVID, but he still came in to the hospital, and then he got tested, and that morning, so he saw one patient, and unfortunately, so the transmission happened. So after that one, all affected individual patients on the ward were again reviewed. Patient and staff screenings were done, and patient moved to a single room in-suite facilities as well. And again, the same things were done. For example, patients and staff identified who had contact with the positive case 48 hours before the first positive, audits done, and isolation precautions and cohort nursing were done as well. So even after doing those things, so there's a repeated case of the outbreaks, which is very concerning and very alarming as well. So which is still working, and from October till now, there's another 2 outbreaks here, which is not mentioned, of course, not mentioned in the project one, but there has been reported incidents, and all the surveillance, all the testing has been increased, and it has resulted prompt response and helped mitigate in the further episode of transmission, I hope. So this is our report. Thank you very much for listening. Thank you.